Welcome to Nutrition Rounds with Dr. Danielle Belardo, the podcast for anyone interested in learning about plant-based nutrition through an evidence-based approach. Every week, we share insights and interviews with physicians who are leading experts in nutrition and health. Whether you've been plant-based for many years or are still searching for the perfect diet, Nutrition Rounds will inspire and empower you to live your healthiest life backed by science. Now here's your host, Dr. Danielle Belardo, MD.
Hello, and you are with Danielle Belardo, MD, on this episode of Nutrition Rounds. Today, we have the absolutely incredible, mind-blowing, brilliant episode with Team Sherzai. So, Dr. Sherzai are a unique husband and wife team on the cutting edge of brain science. Dr. Dean and Dr. Ayesha Sherzai are dedicated to educating people on the simple steps to long-term health and wellness through their work as directors of the Alzheimer's prevention program at Loma University Medical Center with patients, as well through online writing, videos, and books. There's a tsunami of diseases of the brain, such as Alzheimer's, stroke, Parkinson's disease, just permeating our culture. And in our own communities and families, we've known tons of people that have had at least one of these diseases and suffering from many of them. So the Sherzais see scientists and physicians working furiously to find a cure for these diseases, and in this frantic race against time somehow. And the big picture is usually lost among the molecules and chemicals related to diseases. As co-directors of the Alzheimer's prevention program at Loma University Medical Center, the Sherzais, through research and their extensive collective medical backgrounds, work to demystify the steps to achieving long-term brain health and the prevention of devastating diseases such as Alzheimer's and dementia. Team Sherzai, MD, PhD, is co-director of the Alzheimer's prevention program at Loma University. He trained in neurology at Georgetown University School of Medicine and completed fellowships in neurodegenerative diseases and dementia at the National Institute of Health and UC San Diego. He also holds a PhD in healthcare leadership with a focus on community health from Andrews University. Ayesha Sherzai, MD, is a neurologist and co-director of the Alzheimer's prevention program at Loma University, where she leads the lifestyle program for prevention of neurological disease. She completed a dual training in preventive medicine and neurology at Loma University and a fellowship in vascular neurology and epidemiology at Columbia University. She's also trained plant-based culinary artist. These two physicians are changing the world. They are neurologists that are changing the discussion about brain health. They are changing the way we look at Alzheimer's disease, a disease that many of you sitting here right now think is not preventable, a disease you think may be caused by genetics. I've heard everything from bacteria, genetics, to just luck, that, it's just an outcome that you're going to be stuck with. They are really changing the way we believe in brain disease in general, and they will show you through all of the research they've performed and what they do in their clinic that you can prevent Alzheimer's disease and dementia in many, many, many ways with a whole food plant-based diet. They'll also explain to you diseases like stroke and how all of these disease processes can be mitigated by plant-based nutrition and help to prevent the diseases that are devastating and neurological disease throughout the world. The two of them are changing this dynamic, and neurologists across the country really have to think twice before they prescribe just another medication and don't think about nutrition as a major point of prevention. I'm beyond honored to have these two on the podcast, especially because there's such a close relationship between neurological disease and cardiovascular disease. There's so much overlap that we know that preventing cardiovascular disease prevents a lot of neurological disease as well. And we constantly are seeing each other's patients. So get ready to learn everything you thought couldn't be prevented from a neurological standpoint. So much of it can. And this episode is mind-blowing. So much that they explain was even new information to me. So I really think that you guys are going to love it. And make sure to send this episode to anyone you know that's worried about dementia, Alzheimer's, stroke, and any sort of neurovascular disease, because this was really life-changing. And I think that this dynamic and this change in the conversation that the Sherzais are bringing the world needs to be heard by everyone. So don't forget to rate, review, and subscribe for us on iTunes. And when you guys have a listen to it, tag us and tag Team Sherzai in your Instagram story and posts. Thank you. And we are here with the most unbelievable neurologists that I'm so honored to speak to, Team Sherzai. Both of the physicians, if you guys want to introduce yourselves.
I'm Dean Sherzai. I'm a neurologist trained at Georgetown, and then did some experimental therapeutics a decade ago at NIH. And then I worked with Leonthal at neurodegenerative diseases at UCSD. And then we chose to come to Loma to study lifestyle and its effect on brain diseases.
It's a pleasure to be here. My name is Ayesha Sherzai. I'm also a neurologist, and I have a specialty in lifestyle medicine. I'm a preventive neurologist at Loma University Health, and our focus is on highlighting lifestyle as an important, probably the most important tool in the prevention of neurological diseases like stroke, Alzheimer's disease, Parkinson's, and others.
I am so honored to have you both on the podcast. I've had so many people asking for you to be on here. And so I'm just so excited to get to talk to you both. I definitely feel a close relationship with neurology. In cardiology and neurology, we have a ton of overlap. So a lot of questions I'm going to be asking you. Some of them are from my listeners, but then some are just for myself, for my own learning. And I just want to tell you both, you've done so much in your book. The Alzheimer's Solution is incredible. It's just absolutely one of the most brilliant books that I think has been out for preventive neurology. And I hope everyone listening to this goes and checks it out. But I wanted to start out by saying that February is Heart Month, and I know stroke is a huge part of Heart Month as well. So I know it's a big part of the month for you guys too. And because it's Heart Month, we're really discussing prevention. So I wanted to start out with some stroke statistics. So from the CDC, we have stroke kills about 140,000 Americans each year, and that's one of every 20 deaths. Someone in the United States has a stroke every 40 seconds, and every 4 minutes, someone dies of stroke. Every year, more than 795,000 people in the United States have a stroke, and about 610,000 of these are first or new strokes. About 185,000 strokes, nearly 1 in 4 people who have had a previous stroke. And about 87% of all strokes are ischemic, in which the blood flow of the brain is blocked. And stroke costs the United States an estimated $34 billion each year. And stroke is actually the leading cause of serious long-term disability. And stroke reduces mobility in more than half of stroke survivors age 65 and over. So starting out with stroke and what you both do, I was wondering if you could just, introduce your knowledge and information about prevention of neurovascular disease through lifestyle modification.
My goodness. Thank you for that question, and thank you for those statistics. I'm specialized in vascular neurology. I did a 2-year fellowship at Columbia University to study stroke, and most of my time was spent in the neuro ICU and at the hospital floors. And Danielle, you're familiar with that. Looking at the quick treatment of stroke, people coming in with neurological deficits like paralysis of their arm and leg and not being able to speak. And usually we spent thousands and thousands of dollars on diagnostics, whether it was MRI or CT angiograms and transthoracic echocardiograms. And at the end of the day, it was essentially making sure that the size of the stroke doesn't expand and that the patient is stabilized. And, for the majority, they would be sent out to a rehab facility to get physical, occupational, or speech therapy, depending on their deficits. And obviously it would be, throwing statins and, blood thinners at them and managing their diabetes. And, a simple stroke actually workup costs close to about $40,000 within a couple of days. And at the end of the day, all they go out of the hospital is with an aspirin and some cholesterol medication. But there is so much data. There is so much data that majority of strokes are preventable. About 80% of strokes are preventable, whether they're ischemic or hemorrhagic. And data after data, decades after decades, we have data that lifestyle, particularly nutrition, is incredibly important, because when you look at the vascular risk factors like high blood pressure, diabetes, and cholesterol, These are diseases that can be managed, that can be prevented by nutrition. We all know that eating a diet that is low in sugar and processed food, eating a diet that is low in saturated fats and animal proteins, actually reverse diabetes. They lower blood pressure and get rid of it completely, and cholesterol as well. I had the pleasure of working with my mentors at Columbia University on an incredibly interesting and exciting study on one of the largest databases in the world, the California Teacher Study, about 133,000 women that were followed for 25 years. And, we looked at this population, we looked at what they ate, and we had information from these individuals for decades. And I was interested in finding out nutrition and how that was associated with stroke. Danielle, we've heard about the Mediterranean diet being touted as the best diet for stroke prevention, for heart disease, so on and so forth. And I was intrigued about this whole concept of Mediterranean diet, of what it was. And so I analyzed the Mediterranean diet and, wanted to find out, what was in the Mediterranean diet that affected stroke. And a lot of people, when we talk to them about Mediterranean diet, they think fish, maybe wine, and, some cheese, sitting next to, a lake and listening to some, Mediterranean music, which is all good. But, when you look at the Mediterranean diet score, people who adhere to Mediterranean diet essentially means that they eat a lot of fruits, vegetables, legumes, whole grains, nuts and seeds. And what does that sound like? That sounds like a whole food plant-based diet. And it has to be low in animal protein, animal fats, dairy, poultry, and other sources of saturated fats. The only thing that is in the limbo is fish or omega-3 fatty acids. But they actually look at the level of omega-3 fatty acids rather than the fish itself. So people who actually have sources of omega-3 fatty acids tend to do better. And in this database, I found out that people who adhere to a whole food plant-based diet, aka Mediterranean-ish diet, they actually lowered their risk of stroke by 44%. 44%.
Now imagine that number. We don't have a pill that does even a fraction of that. Yeah. Yet we lowered the disease that kills nearly 1 million people by 44%. I'm going to brag a little. She won the youngest researcher award for American Heart Association for this, so they accepted it. And she was the youngest plenary speaker at the main conference 3 years ago. So they didn't just push it to the side. They couldn't. The largest study ever that showed that stroke could be reduced by 44% by whole food plant-based diet. Doesn't get bigger than that.
This is blowing me away. Why do you think that this is not first line, the first thing that neurologists across the country are telling people to do with regards to, and with all of the information we have about reducing your stroke risk? They mention, watch your blood pressure and, treat your diabetes. But why do you think that this is not the first line that every neurologist is telling their patients?
Because we're cynical. We don't believe that we can bring change. And we were never trained in two things. One is lifestyle and nutrition. The second thing is behavior change. We're never trained in that. So we go through 16 years of training in a very authoritarian, dictatorial way. So if you're told something, you're supposed to do it. And we know with lifestyle that doesn't work. So we come out of this whole machine extremely cynical. And that's where we fail people over and over and over again. And the rate of stroke keeps climbing. We work half a day in a free clinic, in SAC clinic. We're seeing stroke patients in their 40s. Every single day, Absolutely. We're seeing dozens of people in their 40s with stroke. And it has to do with nothing else but food and lifestyle. And yet we have a paper that Ayesha is the first author in, which shows that a whole food plant-based diet reduces it by 44%. Imagine the cost benefits.
And one of the other things that we found also, and you can see, variations of this in multiple other research projects as well, that it's not an all or none phenomenon. For people who are not used to eating a whole food plant-based diet, every step towards that optimal diet by making small incremental changes makes a big difference. And so, instead of getting scared of this massive change in their lifestyle, I think us physicians, we're all responsible to help patients identify their next step and then moving forward. And I think that's great. That's great news.
I can't tell you how much I love everything you were both saying. It's like you're actually just reading my mind. With regards to the two things that we don't learn about in medical school and medical training, both nutrition and behavior modification, I couldn't agree more. I truly believe that one of the biggest faults we have as doctors is we don't believe in our patients enough. And
Yes.
I've been able to see so many patients, once given the option about plant-based nutrition, they actually jump on it and they just are looking for guidance. They're looking for a physician to believe in them. And I do completely agree with you. I think as a medical profession, we just are cynical and we trust medication adherence more than lifestyle modification, when we know in lots of research and data and evidence that medication compliance isn't that great anyway. Plenty of people have a heart attack. We tell them to go home and take their statin and aspirin. Months later, not everyone's adhering to their medications regardless. So I think that you really hit the nail on the head with the fact that it needs to change in the dynamic of counseling. And it's really, I want to say it's really heartbreaking that you see 40-year-olds with stroke, but I cannot even say that it's that unbelievable because I'm seeing the same with cardiovascular disease, heart attack, and cardiomyopathy. So how would you explain to someone who's maybe in their 30s, younger, who isn't even worried about stroke, they think it's a disease of, older generations, how important prevention is with lifestyle modification?
By bringing it to them as far as not the end disease, but what's happening to them right now. If we recognize that the journey towards Alzheimer's, towards a stroke is not at the end, you didn't just develop Alzheimer's at 65. The journey started in your 20s and 30s. And
even the name stroke, which means, something happening all of a sudden, is, in my opinion, a misnomer because, it's actually a process. The pathogenesis starts decades before you get to that point.
Actually, do you mind explaining that a little bit for our listeners who don't quite know the pathophysiology of that? That would be great.
So when somebody has a stroke, usually what happens is an artery in the brain gets clogged, either by a blood clot or by thickening of the arterial wall, and a particular area of the brain doesn't get oxygen and nutrition or blood flow, and because it's a very susceptible organ to changes in oxygenation, it dies. The neurons and the brain cells die, and that's how people have a stroke. Now, how did we get to that point? How did we develop the narrowing of the artery? Or how did that clot actually clog the path to the artery? That starts, decades ago with an unhealthy lifestyle. Say, for example, high blood pressure hardens the arteries in the brain. High cholesterol actually causes, thickening of the arterial wall and damage to the inside of the arteries. Diabetes does the same thing. So, even if people don't have diagnosis of high blood pressure or high cholesterol or diabetes, mediocre, moderate levels of abnormal lipids and glucose in the body can cause damage to the arteries, and it potentially causes strokes.
It's not a scare tactic, but it is a scare tactic. I mean, imagine we just shared a paper in Journal of Neurology that was just published on our social media that shows that even minor blood pressure elevation, which happens as a result of lifestyle for majority, in your 30s and 40s is directly correlated with brain shrinkage, significant brain shrinkage. How did that start? That didn't start, so your stroke is just one manifestation, but shrinking of the brain, loss of the vessels and microvessels in the brain. Remember, your most vascular organ in your body is your brain. There are pictures where they've denuded, they've taken out all the tissue in the brain and all that's left is vascular. And you see the true vascular nature of the brain. Those microvessels are damaged every time blood pressure goes up a little bit. So if people take it seriously early enough, they're not just avoiding stroke and Alzheimer's. That's going to happen anyway. You're actually maintaining cognitive health, which should be the most important thing for you. And that starts early in life. That starts with you doing the simple things that affects your lifestyle.
That is so well said. I just am getting so excited hearing you guys say this because it's so fascinating to me how important nutrition is in neurology and how I just love that you're bringing it also back down to the evidence and the research you've done. It's just so fantastic. And I'm happy to hear, I know we spoke earlier about how that it's growing more acceptance in your field. And I think what's also really interesting, more to connect, neurology and every person I've had on the podcast of a different specialty, we've been able to connect all of our specialties with plant-based nutrition because, as when you guys have mentioned, and as I mentioned when I spoke with Dr. Ornish, our bodies, it isn't just one disease process. So our hypertension is related to our diabetes, which is related to our stroke risk, which is related to our heart disease risk. The same vessels that are in our heart and that are in our vasculature throughout our body are in our brain. And whenever we're damaging them, when we're damaging our brain with elevated blood pressure, we're also damaging our heart with the risk of cardiomyopathy. And when we're clogging the vessels to our brain with cholesterol, we're also concerned about clogging the vessels to our arteries. And I think that a lot of the similarities too, in the fact that a lot of it goes silent for so long. So many people aren't worried about preventing it because things like hypertension are a silent killer. They don't even have symptoms for so long. So they're not worried about it. And like you said, not to be a scare tactic, but when the end result is something devastating like a stroke or like an LAD infarct or something that changes your life, it's really hard to say, well, you could have prevented this, but it's really true.
It is.
Absolutely.
It definitely is. And I think it also makes it simple for people to understand that, when you take care, for us, especially in neurology, we say when you take care of your brain, you've taken care of the rest of the body and vice versa.
Very true.
It's not multiple things that you need to do. You just have to understand that the principle is essentially the same thing. Whether it's cancer or Alzheimer's or stroke or heart disease, they're all the same. You have to approach it in a comprehensive way and as early as possible.
Actually, one thing related to you guys that I wanted to talk about, because I have a particular interest in plant-based nutrition with atrial fibrillation. I've actually found anecdotally, so I started a plant-based clinic my first year of cardiovascular fellowship. Now in my second year, I've had about a year's worth of patients, and I've been able to see a lot of my patients with paroxysmal AFib see their AF burden disappear. So it's something I'm looking to study and to do in patients with pacemakers so we can interrogate and see how much their AFib burden decreases. But it's interesting because I wonder if that may be when patients go plant-based, if that may be also a decrease in their stroke incidence as well. If you can decrease the overall systemic inflammation, decrease their arrhythmia burden, if that may change things. I'm curious to see and see what you guys think.
By all means.
Absolutely.
I mean, theoretically, it completely makes sense. And I'd be very interested to see us probably, doing some research together and actually finding that out. That would be an amazing thing to answer.
Yeah, I mean, in many ways, just to go around back to what we started with, which is all these diseases are connected. I mean, in many ways, we say that at the base of a lot of the neurological diseases, especially Alzheimer's, dementias in general, and strokes, is cardiovascular disease. And underneath that is endocrine disease. They're all connected. And if we can affect, and that makes, as Dr. Ornish says, it makes it so much easier. It's not that scary. There is one general answer to all of these processes that can significantly, as much as 80% of chronic diseases in general can be reduced. We're just adding two of the neurologic diseases, maybe more than that, Alzheimer's, dementia, and stroke into that category as well.
Actually, would you be able to explain? So I've actually mentioned both of you in your incredible work to many physicians. And I mentioned how you actually specifically discuss Alzheimer's and how Alzheimer's can be prevented with and preventive nutrition and all of these things. And I have many physicians who has said, no. Alzheimer's, that is not the etiology of Alzheimer's disease. Alzheimer's disease, people think it's from infection, or they think it's or it's genetic, or it's, it's just going to happen. It's inevitable. Can you kind of explain the mechanism of this and how a standard American diet leads to Alzheimer's disease and how a plant-based nutrition can prevent it?
So I'll start with the biggest anecdotal study of history, which is our own. And then I'll go into a little more detail. We chose from UCSD to go to Loma Linda. And we picked a population because I was at the experimental therapeutics branch of NIH doing all kinds of molecular stuff and animal studies at the time, not anymore. And at UCSD, we did all kinds of clinical trials, which was the number one neuroscience place in the country at the time. And we were just getting sick of failure after failure. So we said, let's study population, the only blue zone in America, Loma Linda, and see the effect of lifestyle on something that hasn't been studied, which is brain health. There was some data already from Dr. Guillaume and others that had looked at the Adventist Health Study, a study that is 96,000 people over 50 years. Incredibly robust data with significant data captured. And they saw at the time in 1993 that a plant-based diet was 50% more protective than anything else out there. And remember, this is at a time where Alzheimer's and dementia were not being as diagnosed. So there was a proclivity to underdiagnose it. So that 50% was an understatement. So we went there and we were the directors of the Brain Health Center there, started a clinic. And in a region where 50% of the population is vegetarian. So this 50%, 25,000 people have nowhere else to go but to come to my clinic. And in this clinic, we capture data as far as diet, lifestyle, everything else. And after 5 years, 3,000 people, out of the 3,000 people that had dementia, guess how many of them were less than age 85 that had a plant-based diet, a vegan diet?
Very few.
I mean, you would expect a number small, but as small as 19?
Just 19.
19. And if you added education to that variable,
Wow.
The number was 8.
Oh my God.
I mean, even if I know that the whole coconut oil revolution was based on an anecdote of 1. This is an anecdote of 3,000. I know I have a master's and a PhD and research and all that. I throw away anecdotes but an anecdote of 3,000. There's no way that there would be such a selection bias of dementia patients in Loma Linda traveling 3 hours to another clinic. So that was just one element. Then we looked at other data of prospective clinical studies in Columbia University and Rush University and others, large studies that put people into a whole food plant-based diet. When we're talking about that, at the time, they usually looked at Mediterranean, but now we know how they score Mediterranean. The word Mediterranean is used because it's politically correct. Underlying Mediterranean diet, let's now completely make it naked. Take all its clothes off. What they're looking at is a whole food plant-based diet. Every time they score it, we do this in California teacher study. Every time they score it, they're actually scoring the whole food plant-based component. So when they looked at these composite studies prospectively, again, as high as 53% reduction in Alzheimer's risk. I mean, the data, we've actually put all the data in our book, 300 citations. In fact, they told us that if they had to reduce the number of citations because there was too many citations. The data on effective lifestyle is profound, and nutrition a dominant feature of it.
Yeah, and there's so many other studies too, Dean. The Kaiser Permanente Northern California group recently in 2010, they looked at the same concept of, how does high cholesterol affect Alzheimer's disease incidence? And in about 10,000 individuals, they found out that people who have high cholesterol during their midlife, they had a 57% higher risk of developing Alzheimer's disease. And get this, even borderline high cholesterol increased the risk of Alzheimer's disease by 23%.
So let's look at that. So even if you don't believe in the nutrition, that's the lifestyle variable that you can affect, even with medicine if you take it. So whatever way you're going to affect that cholesterol, that's going to affect the outcome, which is dementia and Alzheimer's. But we know that nutrition was the main dominant feature there.
That's absolutely fascinating and just so brilliant, because so many people, I think, are under this wrong impression that that Alzheimer's is not preventable. I think so many people are worried that it's their family member has it and it's this, genetically process that's going to happen to them regardless. Do you mind actually explaining a little bit of the pathophysiology about how a standard American diet can lead to Alzheimer's, through kind of what you're saying with increased saturated fat and everything that happens with the vasculature in your brain?
So we've looked at the studies, and there seems to be 4 pathways. That's why every few years, one group comes out and says it's a type 3 diabetes, and another group comes back and says, no, it's a fat disease, and another one says garbage disposal disease. Reality is, it's all of those. There are different pathways: oxidation, inflammation, lipid dysregulation, and glucose dysregulation that contribute to this disease process. People come to it from different directions. People who've had traumatic brain injuries, they usually come more so from inflammation. Doesn't mean that it's independent. Whenever you have one process, you usually have the rest as well. But there's a more dominant feature in some groups. So traumatic brain injuries, inflammation, diabetics, glucose dysregulation. And those with fat and lipid dysregulation are a dominant feature. And what supports this, again, is also the genetic studies. The newer studies, the GWAS, genome-wide analysis, shows that there is about 30 genes that have been associated with Alzheimer's. Only 3% of all Alzheimer's is driven heavily by genetics.
Whoa. You need to repeat that so everyone listening can hear that, because that is incredible.
Only 3% of Alzheimer's is heavily driven by genetics. That doesn't mean that the rest is not influenced by genetics. I'll explain that. But I mean, driven heavily means like Huntington's disease. If you have Huntington's disease, you're gonna the child, the son, especially the son, will get it at a certain age because of the CAG repeats. We have only 3 genes that contribute to that 3%: presenilin 1, presenilin 2, and APP. Those genes, if you have those genes, and only 3% of Alzheimer's patients do, you will get the disease in your lifetime. And yes, lifestyle might influence it, but not that much. But ironically, we're about to publish an incredible paper. We were fortunate to get our hand on the data from NIH looking at Down syndrome and looking at all patients, Down patients who live long enough, they will get Alzheimer's. In fact, they get it earlier. They get it in their 40s and 50s. And when they looked at Down syndrome patients and they looked at their high blood pressure, cholesterol, and diabetes, and if those factors were controlled through lifestyle or otherwise, guess what happened? Even in those patients, the disease was pushed back. So we're about to publish a paper in hopefully in a major journal. And that still constitutes 3% altogether. So what about the other genes that have been associated with Alzheimer's, the other 97%? The only controversial thing we said in the book was that 90% of the Alzheimer's can be prevented within normal life. Now, let's break that down. Normal life in the United States is actually now 78. That's sad. It came down from 80. But let's say even 85. That's still not controversial. It's talking about pushing it back. Now, we look at the other 90% or more of genes. They're ApoE4, which is a major gene associated with Alzheimer's. If you have one allele from one parent, your risk goes up 4 times. If you have 2 alleles, it goes up anywhere between 12 to 20 times. But even those who have 2 of those genes, which only constitute 2% of the population, people with 2 ApoE4s, even they, 50% of them don't get Alzheimer's. What happened? Lifestyle. What about the other genes? These other genes are not Alzheimer's genes per se. They're lifestyle genes. In fact, for most chronic diseases, that's the case. They're the genes that have to do with your ability to respond to vascular risk. If you have bad vascular genes, you're not going to be as good at it. So what do? Reduce your vascular risk. How? Through lifestyle. There are immune response genes, meaning that your body's ability to respond to immune challenges throughout life. So if you have bad genes, what do? You reduce your immune response, meaning the inflammatory stuff and inflammatory lifestyle elements. There are garbage disposal genes, lysosomal storage. So if you have bad genes for those, what do? You reduce the amount of garbage that you produce by not taking in as much garbage. I'm simplifying that. But it stresses. So in many ways, all of these are lifestyle genes. So whenever we have a talk, somebody in the front row says, so how do I know I have Alzheimer's? And I say, in the American Lifestyle Conference, we're the main speakers, and several people asked this. Mm-hmm. And I said, well, you do have Alzheimer's. And your neighbor does, and everybody else around you, because it's not a point. It's a range. Your genes in chronic diseases give you a range, depending on how good and how bad you are in different challenges, be it inflammation, glucose, or sugar. So assume you have the worst genes and live so, and you will push that range back as much as 30 years. And that's true in Alzheimer's. That's why there are populations where Alzheimer's is much less and populations where it's more. There are populations that had much less risk before, but now with change in diet, we call it affluence, paradox of affluence, their risk goes up again. That's how genetics and Alzheimer's and many of the chronic diseases work. They give you a range because of these polygenetic, multigenetic factors, and how you've lived your life determines if you're going to fall earlier or later in that range. And that range is wide. And that's how we should approach all of these diseases.
That is so well put, especially because it's not as black and white. I think sometimes patients think that things are going to be, either they have diabetes or they don't. It's like you have pre-diabetes, your body goes through a process, these pathophysiology, these different mechanisms of chronic disease, like you were saying, develop over time. Actually, leading into that, building on that, what would you say to someone your patients who are maybe older, in their 50s or 60s, and they've already had chronic disease? Do you think that there's any way with regards to their risk for stroke or for developing Alzheimer's, is it ever too late for them to change their lifestyle and kind of reverse some of the damage they've done over time?
Not at all. Not at all. And I think you know this, Danielle, you've seen it in your clinic as well. The moment you start implementing lifestyle, especially when it comes to food, you see the numbers dropping. You see the reversal of disease, which, sounds pretty controversial to a lot of doctors when we say disease reversal, because we're so used to managing things, but it actually does happen. And you do see it. And we've seen it in a lot of our elderly population as well. Matter of fact, we published a paper last year looking at insulin resistance, your body's capacity to recognize glucose and use it as a fuel. And how does insulin resistance, this was in Haynes, it's a large population database, how does insulin resistance associate with cognitive impairment? And we found out that in people who don't even have the diagnosis of diabetes, but their glucose levels keep on creeping up and they have insulin abnormalities without any diagnosis, even they are at a higher risk of developing a cognitive impairment early in life. So, instituting lifestyle and changing and reversing their metabolic abnormality is key to prevention of Alzheimer's disease and stroke.
And we've seen this even with Alzheimer's. There are people that have written books and said they've reversed Alzheimer's based on like 10 patients. That's false. Yeah. Alzheimer's, once it's fully manifest, it's not going to be reversed. There's some data that if aggressive lifestyle is implemented in early dementia and Alzheimer's patients, you can slow the disease down. But that's controversial because whether you should even implement that level of change in a patient that's going through that disease once it's only manifest, it's a controversial thing. But prior to developing fulminant Alzheimer's, where at mild cognitive impairment stage or even earlier, we have repeatedly seen patients improve significantly. Absolutely. And we've actually implemented in our own populations. We have a clinic based on this. And we have two major studies that actually are underway. One is a smaller imaging-based study where we're looking at neuroinflammation, which is very unique.
How are you imaging? What are you guys using? Well, this is fascinating. What are you? Tell me.
So Loma Linda has this unique ligand that looks at neuroinflammation. And then we have another one that looks at axonal growth, which is synaptic density, it's called, looking at the density of synapses. So these are ligands that bind to different things, including inflammation as well as and synaptic density. We're putting a group of people into a significant lifestyle intervention with a higher focus on nutrition and doing imaging before and after, as well as neurocognitive before and after. And this will be a groundbreaking study because we're looking at mild cognitive impairment patients.
Yes.
These are pre-dementia patients and looking at pre and post. That's one. The other one, which is absolutely remarkable, is we're in charge of the largest community, district-wide brain health initiative in the country. In fact, the only one in beach cities. This is Manhattan Beach, Redondo Beach, Hermosa Beach.
In Southern California.
Which for the last 9 years had undertaken a blue zone project, which all these regions were blue zones, that every restaurant had to have at least one menu item that was whole food plant-based. There's signs everywhere. There are walking zones. It's an amazing, amazing place. And we were given the privilege of taking the research on, as well as the Brain Health Initiative. And we have 1,700 people going through yearly intervention of intensive lifestyle, 500 of them intensive lifestyle, 1,200 of them observational, through 3 years. But we're studying them every year, looking at the influence of intensive lifestyle on their cognition and cognitive decline. These are two groundbreaking studies, one more population-based, another one all the way the other way, which is molecular and imaging marker-based. We're very excited. And this comes out of the fact that we've seen it in our own clinic, and we've actually done the research in it.
That is so exciting. And I think it's great that you're focusing especially on the adding imaging to it. Is just really fascinating to me, the inflammatory imaging in the brain, because I'm actually very interested in inflammation and the gut microbiome and how that relates to cardiovascular disease with TMAO. And now we have, with our new cardiovascular risk stratification, we're using high-res CRP to help us further risk stratify our cardiac patients. And inflammation is truly I think anyone listening to this podcast is going to be like, you talk about inflammation every single episode, but it really does have to do with every single disease process, whether it be cancer, cardiovascular disease, neurological disease.
We agree.
The gastrointestinal disease. And so it all starts with the gut microbiome. So for people that follow, say, a Mediterranean diet, or even there's people that follow the keto diet that think that some of their biomarker, sometimes I have people messaging me saying, and I do not believe in anecdotal things either. I truly follow, the research and the evidence. But, sometimes people say, well, my high risk CRP came down and I've been keto for 6 months. And I think that is also the reasoning I have for that, is that it's in the setting of weight loss. But why do you think that saturated fat and high animal protein, animal fat diet with a standard American diet with processed foods does contribute more to these neurovascular diseases?
It speaks to what you just said. We completely are aligned with you as far as inflammation. I think, even though we talked about glucose dysregulation, lipid dysregulation, and oxidation inflammation, the dominant feature seems to be inflammation in every disease process, and we completely agree with you. And when it comes to saturated fats, the data, both as far as molecular studies and interventional studies at NIH, repeatedly have shown that saturated fat, besides everything else, as far as its effect on insulin resistance, as far as its effect, but the dominant feature seems to be, even with amyloid, the dominant feature seems to be inflammation and how it actually provokes inflammation through different pathways. So with keto diet, I just wanted to allude. We did a little, live stream session on keto diet. I call keto diet a cheap towardly relationship. I'm going to take your time. I'm going to go date.
Cheap tawdry date.
Yeah, because
it's not a relationship.
Yeah, with a glucose. If anybody knows biochemistry, they know how hard this poor little molecule has to work. First of all, there can't be a lot of it in the stream. And then by chance, it gets to the door, which is the receptor. And first of all, the receptor has to be there. There has to be a door. And then the door happens to open because you were the right kind that opened up. Then the father comes in with a shotgun. And then the uncles. This is one of those big families, cyclic AMP, and then 6 other pathways that you have to go through. And then once you've gone through everybody, even the weird uncle, then you're sitting down, and now this is going to get a little risque. Then by chance you get into the mitochondria, and then you have to do more work. But you have to do that kind of work to kind of know each other and get to know each other, and the receptor dose doesn't go down, and then you have a long-term relationship. Ketones, yeah, you feel good because you're not taking carbs. The 4 pounds or 5 pounds of carbs are lost from your big muscles, and then the water with it, so fast weight loss. Oh, I feel good. And then the other reason you feel good is because ketones are small, so they get right through the cell wall. They're getting through the window into the girl's bedroom or boy's bedroom, whatever the case. I don't want to be sexist. and then you feel good for a while, and then what? Then you have to face the rest of the family, the inflammation, the oxidation, the glucose dysregulation.
It's not a good long-term relationship.
It's just not a good long-term relationship. So the fact that you keep hearing from them that they feel good initially, 6 months, they lost weight initially, and then no data. And anecdotally, we keep in our trends, we keep seeing, I've been at it for years. Show me one study that shows that.
Right.
Show me one study. No, it's not there because you're not supposed to be in long-term ketosis. The whole thing came out of our field. A small population of seizure patients who were not controlled with 3 or 4 anti-seizure medications. Why would you use that situation as a model for the rest of brain health? That's ridiculous. So I think we've completely lost ourselves in this keto thing. Why? Because the biggest human problem, which is confirmation bias. Everybody wants to confirm that the bacon they're eating is actually medicine. Everybody wants to confirm that what they're doing is still good. And confirmation bias is not got taken away by knowledge because you just have better language to confirm your previous biases. The only way you can actually do this is by repeated studies that show, whether it's population-based studies, which have shown that there's much lower dementia, much lower stroke, much lower cognitive diseases, definitely heart disease and diabetes in populations that are whole food plant-based, and cross-sectional and retrospective, and of course the clinical studies. And the only lifestyle choice that has shown that repeatedly across the different forms of research is a whole food plant-based diet, not just short-term, but long-term as well.
You need to patent that analogy because that is the best analogy for keto.
I'm going to offend a lot of people with that analogy, but that's okay. It kind of makes the point, doesn't it?
It is the best analogy I have ever heard. And it is like, it's just, I'll never forget it. I don't think anyone listening will either. That was amazing. I actually have had several people ask me about multiple sclerosis. So people who are MS patients, every single MS patient that I've ever encountered and that has now contacted me even through social media has said, my neurologist has never, ever, ever spoken to me about diet. And these are mostly younger patients that are, I have a lot of females that have contacted me about it. They're in their early 30s, late 20s, and they're looking to see if they can change the trajectory of their health. And none of their neurologists bring diet into it. Can you discuss how multiple sclerosis may be, one, the course may be affected by a change in diet, and two, why neurologists aren't focusing on that in general?
Although there isn't a lot of data, but we just talked about this, that at the core is inflammation, and no disease or very few diseases that are more inflammatory provoked or inflammatory driven than MS. Mm-hmm. It's a demyelinating disease that has, of course, there are different kinds, but they have undulating onsets, and there are times where it comes to its fulminance, and then there are times that it actually becomes dormant. But at the core, you're looking at inflammation, neuroinflammation, inflammation of the myelin and the brain. So, of course, if you're going to affect it in inflammation, it makes sense that it would be less frequent, or at least the outbreaks or the inflammatory outbreaks are reduced. And it would be interesting to do studies that are more broad and prospective with MS. I think it would actually be a wonderful process to study in a disease that would be most responsive to it. And the question of why neurologists are not speaking to lifestyle and diet, in particular in MS, because neurologists or any doctor in general will not talk to lifestyle or nutrition to any disease, even diabetes. Right. How often have you seen in your clinic that somebody truly spent, even here in Loma Linda, truly spends quality time empowering people with the ability to change their lifestyle? What I mean by that is giving people the ability to change their lifestyle, not just throwing some data at them. When data after data shows that when you just throw things at people, you actually disempower them. You have to know where they are in their journey. You know, the behavioral change theories, there are many of them, but theoretical theory says you have to be in the, whether you're in the pre-contemplative, contemplative, are you prepared, or in the action group? Whenever we ever approach patients like that, you have to know where they are in their journey and then give them the tools. And in a lot of times we make them feel guilty as if they're not motivated. Mm-hmm. And I hate the word motivation because it's nothing. What does that mean? It just says that I'm motivated and you're not. Like you're doing something wrong. And how we approach motivation is if the person is at the point of action, and we say, okay, what's your goal? To change my diabetes. Okay, what does that mean? There are these things that affect sugar, fat, and we break it down even further. Saturated fat from cheese, butter, meats. Which one of those do you think you consume a lot of? Let's say cheese. And the answer is not all or none. Okay, now quantify your cheese. I'm having 10 slices of cheese a week. I'm just making that up. Okay, just focus on that. Just focus on that. And then reduce that by 50%. That's a SMART goal, specific, measurable, attainable, time relevant, and time bound. And when you do that, what you do is create habits. Neurologically, the only way you can create positive habits is if you repeat something towards a success long enough where the brain actually brings this other emotion next to it, says, I like it. Those are the two big language factors of the brain. I like it or I don't like it. And there is the first definition of motivation. When a behavior is repeated towards a success, the brain actually says, I like it, and it does more of it. That's a doable process. Instead of saying, you just have to eat healthy. Or maybe if somebody's a little more knowledgeable, you just have to eat more plants. That's not possible in 300 million person population. Mm-hmm. You have to give people a pathway. And this is the way you do it, is by give them successes towards that path and specific. And it doesn't take that long. Look how long this took. What are you eating? And that's fat, that has fat, cheese, butter, meat. Which one are you willing to reduce? Let's reduce it by 50% over the next 6 weeks. And that actually changes the fabric or the mechanism of habits in your basal ganglia.
Wow.
Yeah, that's the only way. When were we ever trained about this? Never. So that's why, never.
There's a joke in the field of neurology where they say neurologists only diagnose and audiose. That's what they do. And that's true because none of us actually spend time in understanding habits and prevention of diseases, unfortunately.
The fact that you're bringing attention to this is really blowing my mind because it's so fascinating that you're explaining how we even develop, how these neural pathways actually create, how we create habits and how we stick to them. And I think actually Dean Ornish spoke to this, which was interesting, is that, fear is not the greatest motivator, but feeling good is. And that when people go plant-based, a lot of times when they start to feel, decreased angina because of increased nitric oxide, and they start to feel, less short of breath, and they start to, because of the total body inflammation that decreases, they have improved bowel movements. And those are measurable aspects of their day-to-day life that are improved. And I wonder if, subconsciously too, that's what helps people stick with it, because it isn't even just the fear of this stroke and fear of Alzheimer's, for a 30-year-old that's healthy now, that doesn't even worry about those things. They feel invincible. It's the actual day-to-day feeling improved and more energy with the change in lifestyle.
We fully agree, but there's a little bit of a caveat to that, because when you try to give up sugar, which is, at times more addictive than cocaine, you're not going to feel good at the beginning. And a lot of my patients come and say, I just don't feel good. And you remember a lot of people who go even whole food plant-based at the beginning, because the feeling is a habit thing. It's not even a matter of the taste itself. It's a habit. And giving up a habit like sugar, which is addictive, is going to be hard at first. It's withdrawal, and they have to be aware of that. But then I think the thing that we see repeatedly, usually around, it depends on different people, around 2 months or 3 months, is when they've given up sugar or cheese. Initially very hard. But then after 2 to 3 months, every single one of our patients have come back and said the fog has lifted.
Yeah, that's what we hear all the time.
So we have to kind of make them aware that the reason they're feeling not good is not because it's the loss of sugar or, your candy that you were eating is actually doing bad to your body. That loss is not bad. It's your withdrawal. And then in 2 to 3 months, almost every single patient, because that's your brain has actually gotten past that addiction, every one of them say the fog has lifted. Let me go over the habit component a little bit, because it's so important. Habits are developed early in life, and majority of our habits are developed. These are the pathways that are repeat circuits, and computer, they call it macros. Because your brain doesn't want to work a lot. As it is, your brain is consuming this 3-pound organ, 2% of body's weight, is consuming 25% of body's energy. So it wants to be energy efficient. So it wants to have repeat circles. It wants to have habits. And these habits are established, guess when? Majority of them during your teenaging life. When we give talks, we say, really, you want to live the rest of your life through your teenage habits, which were created through God knows what insecurities? It's time to reprogram the brain. And reprogramming of the brain has to be very specific, slow, and at times it's going to be hard. And people have to know that. But when you come out the other side, which is usually after 2 to 3 habits, is absolutely a transformed person. It's remarkable.
Yeah, and I think just to add to that, in the clinic, when somebody comes in with slew of medical issues and they have lots of risk factors, it's very important for us to, as physicians, to realize what works for that individual. And a lot of times you cause more harm by giving them way too much information and way too complicated information than is necessary at that stage of their life. So say, for example, if somebody comes in and we have a spectrum of different patients. We have patients who, have, say, for example, identified 100 food allergies and they're taking like a ton of vitamins and minerals and they're completely into it. And then we have patients who don't even know what beans are, right? So you basically try to find out what is the next thing they can do to improve their health. You don't talk to them about, say, for example, going on a fasting diet if they are completely used to eating fast foods and Wendy's, going back home every day from work. And that's where the habit component behavior is very, very important, and identifying the particular behavior for a patient.
Yeah, if we don't identify the particular success that they have to actually give you, we're again doing the same thing. We're throwing at them a bunch of things or one thing that they don't even recognize. So but the success component is critical.
So for someone that has a sugar addiction or cheese addiction, I've been plant-based like my whole adult life. So I don't remember the cheese addiction, but for people that have a true, sugar, cheese addiction, and I know it's real, they feel it. Can you give them an idea of how long? Do you think it's about 2 months in which they can start to feel after the withdrawal's over and they start to almost forget about their addiction to, say, sugar or cheese? What would you say the timeline is for that?
Well, you're speaking to one of them right here. I think
first-hand experience.
Yeah, I think I can speak. Ayesha and I have been married 15 years. When we first married, we were not whole food plant-based, but we quickly, and Ayesha's addiction was candies. Yes, and sugar. And mine was meat. I mean, I grew up in a family of hunters. We had a farm in Charlottesville that just for hunting. Thank goodness I was the worst hunter in the history of mankind. Yeah.
So you didn't hurt any animals?
I almost hurt. Yeah, no, probably shot some cousins, but Ayesha's addiction was to sugar, and you can speak to that.
Gosh, it's hard. I mean, it took me almost a year to get over it, and it's the initial phases that are the withdrawals from not having sugar and kind of attributing that to not getting good calories and you needing it for an energy burst. About 2 to 3 months later, I kind of saw some serious changes. And until the habits started kicking in where I was aware to completely stay away, where I wasn't drawn to, say, for example, a candy store or going to the gas station without even staring at the candy shelf, that took a while. But it took me about 3 months to get over the withdrawals, which were severe headaches, drowsiness, even memory problems. And I knew the pathophysiology. I knew what was going on in my brain and in my basal ganglia. But one thing that helped me was replacement. Replacing that sweet tooth with something else. So going towards fruits and putting some dates in my cereal, and the texture, the sweetness, the taste. And that was one of the reasons why I went to cooking school, was because something has to be delicious for you to eat it.
You also married me at the time. So, no, I'm joking. But
the tooth was cured.
No, but and for me, the meat thing, actually, I thought it would be very difficult. For me, it took actually very little time. Probably in a month, I was past it. It was shocking for a person who grew up in Pittsburgh, and I would have, I would drive to Philly for Philly steak and cheese all the time, and I would have, all kinds of meat. After a month, I didn't have that craving. So what that speaks to is there's a lot of these 6-week programs, and in 21 days your habits will change. No, it depends on person's previous state. It depends on the particular food or addiction, but all behaviors change. Don't fail yourself just by saying that, mine is taking a little longer, or every person is different. But the reality is that every habit can change. It's all very personalized. Usually, even the most difficult habits, in worst case scenario, we're talking about 3 months. But it varies. So I want to make sure that people don't fail themselves by holding themselves to a standard that's been given on a internet
and
channel.
Also to understand that it's not about depriving yourself of food.
Yes.
There's always a replacement. I work with a lot of people who are addicted to cheese. They're almost plant-based, but they just can't let go of cheese. And, trying to teach them about, the plant-based cheeses that are out there. They're not the healthiest in the stores, but it's a great replacement. It's a great transition. The concept of transition, teaching them about nut-based cheeses, giving them recipes to actually make it for themselves, and, slowly and gradually give them hope that they will get over it. And that's one of the reasons why, we actually teach people how to cook. And when I was in Columbia University doing my fellowship, I remember being in the ICU in my scrubs every day. And then at night I would take the train downtown and go and learn how to cook. I'd be cutting, onions and potatoes and learning how to cook, just because of the concept of not being able to get over things like cheese and sugar and meat.
This is so fantastic. I really think it's just Loma, Linda, and what you both have done is just so revolutionary. I really wish it was replicated in neurology departments across the country, because this is a really unique but special approach that you both have. I completely agree with you're also approaching patients with the readiness to change and kind of knowing where they are in their process of change. So I'm on the cardiac ICU this month, and I recently was saying that, when I'm in the ICU is one of those times that I don't often speak to patients about lifestyle modification because they're intubated, sedated, and it's not the time. But, I found that one patient that was not intubated, he was taken off of BiPAP, and we were talking about his new diagnoses and how ill he was. And there was a point that my brain said, okay, just explain his medications and move on and, just keep going. And then I was like, because he looked at me and said, am I going to have to be on these medications forever? And I looked at him and I was thinking I should just keep moving on my rounds. And I looked at him and his wife and I was like, this is actually every disease process that this particular patient had. I said, I know can be fixed with lifestyle modification. So actually there's something called a whole food plant-based diet if you'd be interested. And this is in the middle of the cardiac ICU. And the patient and his wife were completely on board, scheduled to see me immediately as an outpatient, jumped on it. The fact that I even provided them with an opportunity, and I just think that patients are just looking for that. They're just looking for an opportunity. They're looking for, especially, someone that's going to listen to them and see how ready, like you're saying, they are to change and not force it. And I also do agree with your reducitarian approach too. I think that's very important. I think that people sometimes worry with dieting and with changing a lifestyle has to be all or nothing, black and white. And we know from a lot of data and research that little incremental changes, every change can bring more of a positive outcome in the patient's, chronic diseases and reversal of disease, and that making changes shouldn't have to feel like it's all black and white. And if a patient's going to eat turkey on Thanksgiving, then, and that's what's going to be the one time a year they meet, well, then that's going to be that. But, I think that it's great that you guys also approach it in that way, that patients should just continue to make modifications that are going to help them long term and not be kind of put off by the bumps in the road through their medical, healing and journey. I actually also wanted to ask you guys, so do you have, I know that you both advocate for whole food plant-based nutrition as I do. I was wondering though, do you have any specific foods, fruits, vegetables, anything that really optimize brain health because there's always some hot article that comes out, blueberries for brain health or broccoli for brain health, something. So is there anything particular, or do you think it's just in general overall great lifestyle and diet that helps?
There are certain foods that are emphasized more. Greens, beans, and berries. If I had to pick the top three, green, beans, and berry. Greens, why? Because the polyphenols, the incredible amount of anti-inflammatory components in the fiber, and it's in a beautiful balanced way that you introduce it to your body. Beans, because of the complex starches, they actually they moderate your glucose level in your circulation. You've heard about the second meal effect. If you eat a large quantity of sugar and you eat beans on top of it, the starches in the bean actually keep the sugar in your gut and they don't release it as fast as they should be. And then berries, obviously, they're one of the most potent anti-inflammatory foods in the world. And if you add, a cup of berries, whether it's blueberries, blackberries, or strawberries, it actually provides the right kind of environment for your brain to grow and thrive. And we've seen it in studies from Harvard University how consumption of blueberries actually reduce the risk for dementia in large populations.
Thank you so much for sharing that. And you both have just been just so fantastic. I really can't thank you enough. I really, truly wish they could replicate you and put you in every neurology department, in every hospital, and put this into our medical education. I wish I learned this when I was learning neurology. This is so valuable. And I have so many listeners that are in healthcare, and I really hope that they all take home your message. And do you guys have anything else you want to add or you wanted to bring to the listeners before we close?
I think this is a revolution that's coming. It's good to be in the forefront with you and others who have and people who have actually taken this on earlier, like Dr. Ornish and and Colin Campbell and Dr. Esselstyn and others. It's wonderful to be taking on and changing what we have at this point, which is sick care, to healthcare. And that's wonderful. And it's also important to know that healthcare is not going to happen in clinics and hospitals. It's going to happen in your communities. So to that end, what we're doing all the profits from our book and a lot of what we do is thrown towards our Healthy Minds Initiative, which is a not-for-profit organization that hopes to increase or raise awareness about the influence of lifestyle on prevention of not just brain diseases, but all diseases of the mind, such as depression, anxiety, and others as well, ADD and others. It's critical that we make communities aware that they have control over their own disease process and healthy aging process. And especially not just aging, children and reach cities where we're working, having a more holistic lifestyle approach has reduced obesity in children, school-age children, from 25% to 6% in the last 9 years. So you can do so much more at the community level. So our focus is on the community level. And, that's why we go to all these different communities to just raise awareness. We're at that stage. There's been so much noise and so much focus on disease that most communities don't even know about the fact that they can prevent even diabetes. If you think that Alzheimer's is controversial, just take care of your diabetes through lifestyle. I can assure you it's going to affect Alzheimer's. We wrote a paper on that. So raising awareness that the power is in your communities, is in your homes, and at your work is the most important thing we can do.
I can't thank you both enough for how much you've contributed to the research in this area. You are both so brilliant, and your book is so incredible with so many citations. I mean, people can literally use this as a neurological guide. It should be mandatory reading for every physician in every specialty. It's so great. And the amount that you two have contributed to this space, I just can't thank you enough. You're pioneers. And I hope everyone in neurology follows suit. It's just unbelievable. Where can everyone find you both?
We are on teamsherzai.com, TeamSherzai.com. That's our website. And we're Team Sherzai on Facebook, Instagram, and Twitter as well. And people can check out our community efforts and community work on healthymindsinitiative.org, healthymindsinitiative.org. It's a beautiful life. It's a beautiful way to live, to spread awareness about brain diseases and disease in general. And we're so grateful to be in this journey with you, Danielle. And thank you for everything that you're doing. And we're just incredibly excited with how things are moving forward as far as prevention is concerned. And
we have no doubt that you'll be leading the field of cardiology out of care and more towards healthcare. Absolutely. We have no doubt.
We have to do an AFib study together, because it really is. It's the true bridge of us together. So you two, you really are both. I'm so honored. Thank you so much. And everyone can also find your book on Amazon as well as any bookstore. And your book title is Alzheimer's Solution. Thank you so much. Thank you both.
Thank you, Danielle.
Thank you so much, Danielle.
Thank you so much to Team Sherzai for such an incredible episode. I really feel like I learned more than I could have ever thought about neurological disease and prevention with plant-based nutrition. I want to remind you guys that if you're listening to this and you're already plant-based or you're plant curious, you should really think about joining our 7-day plant-based challenge. So myself, Dr. Michelle McMacken, Dr. Rob Ostfeld, Dr. Joel Kahn, and Dr. Mauricio Gonzalez, and Dr. Angie Sadeghi, we are all really excited about plant-based nutrition. And we're partnering up with Forks Over Knives to provide you a free 7-day plant-based challenge in celebration of Heart Month. None of us are financially involved in Forks at all. We just truly believe in plant-based nutrition, and we love their programs. We are not getting reimbursed for this. We're doing this, and so is Forks, out of the goodness of our heart. For a week, we will just do plant-based nutrition with all of you. You'll get amazing meal plans from Forks that even have meal planning options, grocery shopping lists, everything to make plant-based nutrition not only easy, but also tasty. You're going to be doing it with your favorite plant-based doctor. So everyone that's plant-based knows these phenomenal physicians that I just named, and they are going to be sharing tips with you, tricks, and we're going to be doing it together for 7 days. You can do anything for 7 days. So I really suggest you give it a try. And additionally, Tara Kemp is going to be sharing mindfulness, different sorts of meditation, and ways to bring a holistic approach to nutrition during the challenge. And then lastly, Naimai Delgado and Bianca Taylor are going to share some free fitness for the week to really make this a 360 challenge to get your mind, body, gut, heart healthy for this Heart Healthy Month. You know, I love Heart Month, and I think that everyone in cardiology thinks that Heart Month is the greatest month. We get to wear red and we get to talk about prevention. But a lot of times the discussion of prevention is based on just cardiovascular disease treatment and screening. We often miss the boat on talking about nutrition. So I want to bring that conversation to the forefront. And I think we can do this 7 days of a challenge together. Signups are going to start on February 11th, and the challenge starts February 18th. So get everyone you know involved in the challenge, get them to go plant-based for 7 days, and you will be surprised how much everyone sticks with it. It's really going to be a lot of fun. We're going to be there to support each other, and the hashtag's going to be Plant-Based Heart Month. So make sure to follow the physicians I just mentioned, and if you follow me on Instagram, you can see them tagged in my most recent post. And you guys, you're going to love this. It's going to be a great 7 days. We're going to do it all together. You can start to experience all of these benefits of whole food plant-based nutrition and how delicious it is with this Forks Over Knives meal planner. I promise you, you will not regret it. You're going to say, wow, this is so easy to stick to. I'm so full and I feel so great. And so I'm excited for everyone to give it a try. All right. Have a great week. See you next time.